I have a pleasure to introduce Professor Luke Clancy, who is a founder and director of the Tobacco-Free Research Institute in Ireland. He's an academic physician with international track record in the area of smoking and health, on the causes, management, and prevention of respiratory diseases, particularly air pollution, asthma, cancer, and tuberculosis. He has an experience of over 25 years in directing and coordinating research projects on those various conditions. He's author of more than 300 articles on publications, books on those topics. And we're also pleased to say that Professor Clancy is a member of the ENSP Scientific Committee. So without further delay, Professor Clancy, please take the floor, and we are eagerly waiting for your presentation on e-cigarette use among young people in Ireland.
Good afternoon. Hello, Paulina. Good to see you. You'll not be surprised to hear it's a little rainy here, but we're otherwise very well. And good afternoon to all my co-panelists. I'm delighted to have this opportunity to speak about e-cigarettes in Irish teenagers. Over the last several years, I'm presenting data that we collected as part of the Tobacco-Free Research Institute with colleagues, included in this paper, Dr. Hannafin and Salome Sunday. Mainly it's about a qualitative study which aims to explore factors associated with young people's use of e-cigarettes, and in particular, whether e-cigarette use supports smoking cessation in this group. The data for our information consists of several surveys. The first one in 2004, and that was of 1,000 students in schools in Ireland. And then in 2015, we were the principal investigator for a wave of the SPAD survey, which is carried out all over Europe. And in 16, it was mainly students, school students from Dublin for the SIMNI-R Horizon 2020 project. In 17, we're using data from other people's work and Growing Up in Ireland, which is a longitudinal survey, but unfortunately hadn't any questions on e-cigarettes until 17. And then in 19, a further wave of e-cigarette, of SPAD. As you can see from this slide, e-cigarette usage has been increasing markedly since we started in 2014, when it was about 23%. It increased somewhat in 15 to nearly 25, and in 16 to 29. And then the GUI survey suggests 32-ish% in that survey, but that has a wider age group, and there we don't have the disaggregated annual years. But the last SPAD survey, which was 2019, shows it's 39%. So we can deduce from that that there's been a very marked increase from 23 in 2014 to 39 in 2019. And if you'll have noticed from the graphs as well that the rise was particularly steep since 2016. Now, the qualitative study that I'm going to speak about follows on from that, and it's done in a slightly older age group. We wanted to understand a bit about this phenomena of e-cigarette usage in our young people. We had as a context that e-cigarettes substantially increased young people's likelihood of using cigarettes or smoking. We also were conscious of the fact that the flavorings in e-cigarettes present a potential hazard. And I don't know if you're controlling that, Paulina, but I'll just go back one for it. And also that use of e-cigarettes may lead to physical damage and result in the old favorites of cardiovascular and obstructive lung disease. This study is about 62 young people who, as I suggested, were a bit older than the students we had surveyed. And they consist of two groups, higher education students, 28 of them in 2 centres, and 34 students who were early school leavers and basically are mostly from disadvantaged areas. And they were attending 3 youth reach centres were specially designed for such young people. The study had ethical approval of the Research and Ethics Committee of the Technological University in Dublin. It consists essentially of 22 individual semi-structured interviews and 8 focus group interviews with 40 participants carried out in their own institution. The analysis follows a thematic type of analysis based on Braun and Clark, where all of the interviews were written out fully or transcribed, and then after manual initial coding, they were inserted in NVIVA and used there to develop codes or to identify codes and subsequently to generate themes. Basically, we found 3 themes, and we've labeled these incentives for young people to use e-cigarettes. Included in this are price, where they felt that they were much cheaper than cigarettes or indeed roll your own. Manufactured cigarettes are roll your own. Some people were attracted by the taste and the flavor, but this wasn't universal. But some of them felt that they were real tasty. Whereas another major incentive was the possibility of using them indoors. This obviously in a country where use of cigarettes indoors is banned everywhere in public places. We were a bit surprised at the number of disincentives that they enumerated. For instance, they spoke about adverse health effects, which is interesting because most of the discourse at the beginning and some years ago now was about how safe e-cigarettes were. And we're all aware of the infamous 95% safer than cigarettes. But these young people complained of several adverse effects, such as discomfort in using them, coughing, sore throat, or headaches. Also, they reported negative user experience, both with the taste but also the devices themselves. These were perhaps in the earlier years, and maybe they're better now, but they found lots of flaws with the actual devices at the time. And one that might be predicted, that they could lead to overconsumption and in their minds perhaps greater addictiveness. This is quite interesting and was brought home really by their description that with the cigarette, you light it and burn it and it's gone. But with e-cigarettes, they persist and you can keep on using them and keep on taking doses of nicotine if that's your wish. And it wasn't a disincentive that we expected them to complain about. We were particularly interested, however, in another aspect, which was in whether they were useful for cessation. And we've labeled this theme as ambivalent cessation because despite the fact that many of them, or most of them in fact, said that they hoped by using e-cigarettes that they'd give up smoking, this was not their experience. In fact, almost universally, they found that they continued or in fact resumed smoking. And some of them were introduced to roll your own cigarettes at that time. Dual use of e-cigarettes and other products was common, but that's common in adults as well, but was also very common here among young people. And suggesting addictiveness, they felt that they had an inability to quit using e-cigarettes. So we deduced from that that e-cigarettes is not a mechanism for smoking cessation in young people. Another aspect that came out of many out of the surveys is the reason for using e-cigarettes. While curiosity was the main reason, In 2015, 16 and 17-year-olds, some 17% of them said that they had started e-cigarettes in the hope of quitting smoking. It's of interest that in our most recent survey in 2019, this percentage had fallen to 3. Only 3% said that they thought that they might help them give up smoking. So we can conclude that the young people are incentivized to use e-cigarettes through price, flavor, and the possibility of indoor use. And therefore we recommend, and I'm delighted that we're joined by the EU people in this, and Dr. Sferik, but we would recommend that the price of e-cigarettes be increased in line with combustible cigarettes. I know that's not a competence of the EU, but we make that, and in taxation should be considered. And also that flavors be restricted, and from our point of view, that e-cigarettes be banned everywhere that smoking is banned, including all public indoor areas, and that this is really important because it's a huge reason for them using it. Also, we can conclude that young people are incentivized to use cigarettes through price, flavor, and indoor use. But we would recommend that the price be increased in line with combustible cigarettes, that flavors are restricted, and that there be a ban on e-cigarette use everywhere. Aware of the fact that young people know and are concerned about many of the negative features of e-cigarettes, such as adverse health effects, device problems, and nicotine addiction, we would strongly recommend that health education programs be aware of these concerns of the young people, and that this be part of the content in any health education program aimed at deterring them from using e-cigarettes. There are fuller details of this study recently accepted for publication in PLOS ONE, and I thank you for your attention.
Thank you very much, Professor Clancy, for this insightful presentation. And I maybe would like again to emphasize the summary line that was in the middle of your presentation, that e-cigarettes, they don't prove to be a suitable cessation tool for young people. If you have any other questions to Professor Clancy, please submit them via Q&A and chat. And we will move on to the presentation of the case from Canada on electronic cigarettes by Neil Collishaw, who is a research director at Physicians for Smoke-Free Canada. Mr. Collishaw worked for over 5 decades in public health and for 4 decades in tobacco control. And before he took his position in 2000 as a director in his organization, before he was involved very actively in the World Health Organization Tobacco or Health Program from 91 to 99, where he was instrumental in starting the process that led to the creation of the FCTC protocol. So, Mr. Collishaw, the floor is yours.
Thank you very much, Paulina. I'm going to share my screen now so you can see my presentation. I'm going to be speaking to you today about our 30 months of experience with the Tobacco and Vaping Products Act. It's a new law in Canada. And while things have improved in recent months, the early part of the period wasn't entirely a happy one. On this slide, you can see Drake. And Drake is a locally famous rapper from Toronto. And he did some advertising work for Vype, which is now Views, made by Imperial Tobacco in Canada, which is a subsidiary of British American Tobacco. And this party that he was at was in November of 2018. I don't think he's done any subsequent promotions, but there are hundreds of digital performers on social media who've been working for Big Vape And big vape is really the same as big tobacco during much of the last 2 years. Now, today, we will review what's in this act and related regulations, their strengths and its shortcomings, and we'll examine how the act has helped, but also hindered each of tobacco control and vaping control. And finally, we will assess the progress that's been made and the damage that has been done since the law came into force. Compliance with the advertising provision and other requirements concerning tobacco products in this act is quite high. But vaping advertising and product control are more problematic. There were really no meaningful vaping regulations in place from May 2018 to December 2019, and the two that have been passed since then are, let's say, imperfect. Several forms of vaping advertising are prohibited, but there's less to many of these prohibitions than meets the eye, and we'll speak more of that later. Enforcement of the law did not start in earnest right away. In the early days of the law's existence in 2018 and 2019, advertising violations were rampant and mostly uncontrolled. The important thing to retain from this slide is that under the Act, all ads for tobacco products are banned, except those that are permitted. But for vaping products, it's the reverse. All ads are permitted, except those that are banned. And we'll speak more of that later. From the period before the Tobacco and Vaping Products Act came into force in May of 2018, 18% of grade 7 to 12 students had ever tried cigarettes during the school year, 2016-2017. And this changed little to 19% the following year after the TVPA came into force. That was for cigarettes, but for vaping, it's a different story. This is one of the things that we had in late 2018. That ad was on TV in 2018, in the fall of 2018. We complained about it, and Health Canada sent a cease and desist letter to Imperial Tobacco on November 1st. And this is what happened next. The ad ran over 4,000 times after, or from September to November, and over 1,000 of those occurrences were after November 1st when they received their cease and desist letter. But there was no other further enforcement action. This is an illegal lifestyle promotion that was shut down on April 21st, 2019. Lifestyle promotions were one of the prohibitions that I mentioned earlier on vaping advertising. However, just 4 days later, there was another vape truck parked on a busy street in Toronto, Queen near Spadina, and you could get your free starter kit by mail. So one of our team went into the truck and indeed got a free starter kit by mail a few days later. There were nearly 14,000 instances of vape lifestyle ads. Vape is the predecessor to Views, documented on social media in May 2019. Mr. Hugs and Mrs. Kisses, shown here, were among the many digital performers. This is a rogues gallery of some of the nearly 14,000 social media vape ads that could be seen in Canada. Some were pictures, some were videos. Now, later in 2019, Health Canada became more active in their compliance and enforcement activities. And this slide shows the results of their enforcement activities. And 84% of vaping stores were in non-compliance with the law in one way or another, and 13% of convenience stores. We mapped where the violations were taking place for each city in Canada. Here's an example, but really the only consequence for breaking the law was getting your name in a naming and shaming report that was put up by Health Canada on their website. Unfortunately, the Act does not have a provision to allow for a ticketing offense. And this means that public prosecutors are reluctant to engage in a major prosecution effort for what they view as minor offenses. There are 6 specific prohibitions against vaping promotion in the TVPA, and Big Vape has violated all of them at least some of the time since May 2018. Even today, at least to some people's eyes, like mine, they are in apparent violation of some of the prohibitions, but they've never been charged with illegal advertising. Picture-based warnings have been required on cigarette packages since 2000. The experience and learning of their effectiveness did not carry over to vaping products when the regulation requiring a single text-only warning was adopted on Christmas Day 2019, and the warning is shown here on the right. Now we have vaping promotion regulations, and they do restrict some, but almost all, access by minors to vape ads. And vaping websites and online stores are particularly problematic. Even though there's a requirement in the law that access to these sites be age-gated, they do nothing to shield people over 18 or 19, depending on their province, from vape ads. And this is just a picture I got off the internet, and Jason and Joanne are just names I made up, and so are their ages. But the picture shows what happens. A 19-year-old can simply show a 17-year-old what's on their computer. The 19-year-old can access the ads in the online stores with ease, and it's just a matter of showing the same to somebody else who apparently doesn't have access, and all of that is perfectly legal. So what has been the outcome of this? Well, like in Ireland, the number of vapors has increased dramatically in Canada. Only the increase was dramatic and took place in 2018 and 2019. And now we have nearly 700,000 vapors under 25, or we did at the last survey in 2019. And you can see that the epidemic is concentrated in those under 25. There's been very little change in those over 25. And certainly the weak or absent controls in our law have something to do with this explosion. Now, if we look at the overall use of recreational nicotine or non-therapeutic nicotine, it has increased in both Canada and the United States. While cigarette smoking among 15 to 19-year-olds has been going down, e-cigarettes, as we saw in previous slide, among young people has been going up. And this is the case in both Canada and the United States, to the point where the use of non-therapeutic nicotine has actually increased among young people if you add both cigarettes and e-cigarettes together. In the US, it's reached 15%. In Canada, it's somewhere more than 15%, but it's not 20% as you might think by adding the last numbers on those two graphs, two lines on the left together, because the Canadian data don't separate out dual users. So it's somewhere over 15%, but probably less than 20%. So what could be done? Well, there are many problems, and we would benefit from changes to both the law and the regulations. And we need a list of indicators by which to measure progress in vaping control. Then we need a program of quarterly, semi-annual, annual monitoring to be undertaken. And the indicators could be used to make further changes to law and regulation if we needed. Now, these are tall orders. In the era of COVID-19, the hard lesson we've learned is that failing to take effective control measures puts millions of people in danger of disease and death. We know that this applies to fast-moving epidemics like COVID-19. It also applies to vaping, which I think we can characterize as a multi-speed epidemic. Young people have quickly become addicted to nicotine in vaping. Disease and death will surely follow, some sooner, some later. Professor Clancy mentioned that there's now evidence of risk for lung diseases and heart diseases, and I would concur with his interpretation of the evidence. So far in Canada, our weak control measures on vaping have failed our young people, and I hope that Canadians can come together with their governments to resolve these problems in the coming months and years. Thank you very much.
Thank you very much, Neil. It's a very important aspect of enforcement that you described, and especially with regards to social media aspect targeting young people. Thank you again, and I will now pass the word to Silvano Gallus. Dr. Gallus is the head of Laboratory of Lifestyle Epidemiology at Institute Mario Negri in Milano. He has almost 20 years of experience in the field of epidemiology, public health, biostatistics, and computation. He published more than 250 papers on public health and especially tobacco control. Silvano is our member and contributor to our conference every year, so I have a pleasure to pass the word to him, and he will brief us about what's going on the market related to heated tobacco and also some updates on e-cigarette use from Italy.
Thank you, Paulina. Let me check if I'm able. Actually, I will show you the situation in Italy with reference to novel tobacco products only, and therefore on heated tobacco products. Italy was the first country, together with Japan, launching IQOS as the first heated tobacco product as pilot countries for the Western and the Asian market. In Italy, heated tobacco products increased from 2016. The legal sales of the heated tobacco products increased from 2016 rapidly, and today heated tobacco products represents the second most sold tobacco product in Italy after conventional cigarettes and before roll your own tobacco. Also, our surveys were able to appreciate this increasing trend of prevalence of users. This is an important milestone in Italy on tobacco control, because in April 2018, Philip Morris applied for a marketing claim to Italian Ministry of Health. Ministry of Health had to acknowledge the reduction of toxic substances and the reduction also of potential risk of heated tobacco products compared to conventional cigarettes under the same conditions of use. And what happened is that in January 2019, the Ministry of Health, together with the help of the National Institute of Health, which evaluated the files, rejected the request from Philip Morris. The main issue were on the safety of these products. There is still a huge lack of knowledge on the safety of these products, but also some issues on the public, from a public health perspective, and we contributed to raise these concerns, analyzing data from Italian surveys. For example, already in 2018, we showed how among various IQOS triers, IQOS users, more than 30% were never smokers, and out of among subjects who had an intention to try IQOS, more than 40% were non-smokers, and therefore never smokers or ex-smokers. And this is a new result we are publishing now. It is not yet published. It is in press in Journal Epidemiology, and it is from our survey, European survey within the TACSH project. Afterwards, Olena will talk about this project. We conducted a survey in 12 European countries, and we observed that among ex-cigarette smokers using heated tobacco products at the time of the survey, of the interview, practically 50% quit smoking before heated tobacco products were introduced in the local market of each country. This suggests that these ex-smokers didn't quit due to heated tobacco products, but even relapsed their addiction. So under this evidence, under these concerns on the safety and the public health also issues, it is not clear why heated tobacco products should have these fiscal and regulatory benefits in Italy. In particular, heated tobacco products have a discount by 75% of excise taxes. These products are exempt from smoking bans, advertising bans, and also they do not have the same health warnings of conventional cigarettes. We don't know why. We know that, however, that Philip Morris started donating a large amount of money, more or less everywhere. They started from the Italian Red Cross, donating 500,000 euros in 2017, and we actually, we were astonished, because, in particular because the International Red Cross, they warned the local Red Cross not to accept donations from from tobacco industry, and they warned about the non-engagement with tobacco companies. And with the help also of ENSP, we tried to understand why they decided to accept this donation. We didn't receive favorable feedback from the president of the Italian Red Cross. Once the Red Cross accepted this donation, it is obvious that everyone could accept these donations. And therefore, we have the former Prime Minister who received donations, not him obviously, but his foundation Open received donations from the tobacco industry, and now it is clear that also the main company associated with the main party in the governmental party received something like 2 million euros, 500,000 euros per year as consultant contracts. Our reaction was immediate. There was a reaction of media and independent experts, and we tried to react and contributing to the organized crime and corruption reporting project in these investigative campaigns, also in the TV. And these reactions, let's say, that contributed to a result. The result is that today in these hours, the government is reviewing proposals for new law amendments to increase heated tobacco products excise taxes up to 80% of the taxation of conventional cigarettes. We will see what happens. Another sad story is that the tobacco industry wanted to have a voice also in the scientific debate, and therefore they were invited. They found a way to be invited, paying, obviously. They found a way to be invited to the Congress, to the national congresses, the annual congresses of several societies, scientific societies, accepting money for the organization of the Congress, and maybe something more also, to invite Philip Morris to talk about science. And also in this case, we had a reaction. We prepared the position paper that has been signed by a number of scientific societies. We must confess that not all the scientific societies invited to sign at the end agreed, but most of the scientific societies agreed, and the signatories, they committed themselves to avoid accepting remuneration or support, financial support from the tobacco companies. More importantly, a letter of a very recent letter of Italian Ministry of Health stated practically the same, that they warned the scientific societies to not to accept any direct or indirect remuneration. And therefore, our conclusions are that we found some results which raise concerns about the unfavorable consequences also from a public health perspective. And therefore, our recommendation is to revise the fiscal and regulatory benefits these products have in Italy. Also, since there is no reason why these products, heated tobacco products, should have these benefits compared to conventional cigarettes. Thank you for your attention.
Thank you very much, Silvano, for pointing out those loopholes in regulations that allow the tobacco industry to benefit on taxation, advertising, sponsorship, and smoking ban. And congratulations, at least fingers crossed that the changes will pass. At least it's a very positive sign that it started the process. So let me introduce our next speaker. This is Dr. Xi Sheng, who's an assistant professor in medical oncology at the Department of Internal Medicine in the Ohio State University Wexner Medical Center. She's a researcher and she focuses on the topics of economic analysis of health behaviors with an emphasis on how taxes and policies impact substance use and abuse. So particularly today, Dr. Sheng will speak on the effects of taxes and prices on the demand for heated tobacco products. The floor is yours.
Thank you, Paulina. So good afternoon, everyone. It's a pleasure to be here. So today I'll be talking about a joint study with Estelle Dalci from Campaign for Tobacco-Free Kids and Xiaoying Ma also at the OSU. Let me see if I can move. Okay, so here's our founding statement. And also I will be presenting preliminary results. So these are subject to change. So first of all, I want to provide some background information about heated tobacco products. I think everybody here has already familiar with these products. So these are the tobacco heating systems that heat tobacco filled sticks to generate nicotine-containing aerosol. And the most common brand is Aquas, which was invented by the Philip Morris International. HTP devices and heat sticks are authorized for sales in the US market already, and they have filed for the modified risk tobacco product applications to the FDA and got approved in July 2020. And it has been a market leader. It was first introduced in Japan in 2014 by PMI. And there are also other HTP brands in the global market, such as Gilo and Leo, which is from Korea. As of July 2019, HTPs are available in almost 50 countries, defined as specially designed cigarettes by the WHO. So here are some examples, the images of the different brands. So we all know the PMI has Aquas, and the British American Tobacco has Gilo, and Japan Tobacco International has this Plume Tech, which is also HTP, and KT&G from Korea has this brand Leo. So we, in this study, look at how the prices and taxes may affect the outcomes, the use outcomes of HTPs. So we have measures of markets, including market values and market volumes. So here is a summary of what we have so far. So if we look at the market values in 2018, 11.9 billion US dollars was spent on HTP across the globe, and 10 times more than 2016. By contrast, the market for cigarettes barely increased in value. If we look at the volumes of sales, 52.6 billion sticks of HTPs were sold in 2018, up from 5 billion sticks in 2016. By contrast, the volume of cigarettes dropped every year. So here we show the trends. So these figures show the market volumes and market values of cigarettes and HTPs. So here the red trends show the volumes and values of cigarettes, whereas the blue ones show the volumes and values of HTPs. So as you can see in the left panel, we show the volumes, cigarette sales volumes has been trending down over time, whereas the HTP sales volumes increased dramatically in recent years. And if we look at market values, we see a similar increasing trend for the HTP market value. So for the cigarettes, we see this V-shape curve for the market value. This is because although cigarette prices and taxes have been increasing, the manufacturers and tobacco companies can increase price more than tax increase. So they can still gain a significant profit. So that's why the market value increased in recent years for cigarettes. So, Okay, sorry. So here I want to study how to best tax HTPs. So far, different countries have adopted different approaches to tax HTP heats. None of the countries have imposed on devices, imposed taxes on devices so far. My co-author, Estelle Dalci, has collected the tax information across multiple countries. So she found that some countries designate HTP taxes in a new category. So for example, Czech Republic, Japan, Korea, Slovenia, and some countries treated taxes by default using an existing category. For example, it can be grouped into the other smoking tobacco or PEP tobacco, for example, in Greece, Estonia, and UK. And sometimes they are grouped with smokeless products. So for example, Slovakia and Croatia. And there are also regulations in progress. For example, Philippines, Kazakhstan, and Poland all have proposed potential HTP taxes. So then we took a look at the tax burdens of heated tobacco products versus cigarettes. So we found that the excess tax burden on HTP units is much smaller than that on cigarettes. Despite much smaller excess tax burdens, HTP units are priced similarly to cigarettes. So here we look at the global average. Again, this data collected by Estelle. So on average, if we look at the cigarette price, it's about $5.1. And among this $5.1, $2.8 are taxes. So the tax burden on cigarettes is about 54%. But if we look at HTP heats, the price is quite similar to cigarettes, which is on average $4.7. Only about 90 cents are taxes. So the tax burden on HTPs is about 18%, much smaller than the tax burden on cigarettes. So the objective, again, of this study is to assess the impact of HTP taxes on sales volumes and market value, so we can estimate the price elasticity. In other words, how sensitive the sales volumes and market value are to the taxes and prices of HTP products. So again, the taxes were collected by my co-author, and we also have the cigarette tax information, which comes from the WHO academic reports, and also Estelle from CTFK also collected cigarette taxes based on the reports. And also we have the HTP and cigarette prices from the PMI. So we have their aqueous prices over time, we have their cigarette prices over time. And then we have the HTP and cigarette sales volume and the market values from Euromonitor data. We link the data at the country year level, and we assess the data from 2016 to 2018. That's why I'm saying these are preliminary results, because we're also coding 2019 data. So, okay, so here is a slide that shows the countries where we have data. So the blue ones are the countries where we have both data for both HTPs and cigarettes. The red ones are the countries which PMI reports HTP sales, but we don't have the sales data from Euromonitor. So here are our empirical approaches. So basically, these are just the economic analysis. I don't want to go into the details. But again, we look at both the tax impact on the consumption measures and the price impact on the consumption measures. Again, these consumption measures are the market volumes and values. And then we have the tax and price information. We controlled for a linear year trend and country fixed effect. So this is a cross-country study. And then here are the methodologies. Again, I don't want to go into details, but we try to size the HTP and the cigarette market separately and together. So opposing, using different assumptions on the modeling. So here are our results. So here we look at the impact of taxes on the market value. And here we consider cigarettes and HTPs as separate market. We found that $1 increase in heat access tax per pack leads to a 42% decrease in the HTP market value. We also found that the market value for HTPs, the heats, is more elastic to heat taxes than the market value for devices. And then we also found the market value of cigarettes is inelastic to taxes. So which is unsurprising. So remember I showed the trends and we see the V shape of the market value. So even with the cigarette tax increases, the tobacco companies can still gain profits. So here we don't see a significant effect, but for the HTPs, we do find significant results. So then we look at the impact of taxes on volumes. Here we have separate regressions again. So basically considering different markets. So here we find that $1 increase in heat excess tax per pack leads to a 46% decrease in heat volume. And a $1 increase in cigarette tax per pack leads to a 9% decrease in cigarette volume. So here again, we find expected results, which are that increasing taxes will reduce the consumption. And then we changed our assumption to fit into the reality, which is that HTP market and cigarette market are correlated. So here we use similarity regressions to assess these two equations or markets simultaneously. And then we find that $1 increase in HTP taxes per pack leads to a 44% decrease in HTP heat volume, again, as expected. And then a $1 increase in cigarette taxes per pack leads to a 55% decrease in HTP volumes. So this is a very interesting results, meaning with cigarette taxes increasing, the HTP volumes, the consumption decreases. So here are our conclusions. Higher heat taxes reduce market volumes of HTP heats and devices. Higher heat taxes reduce sales volumes of HTP heats. When considering both cigarette and HTP taxes, higher cigarette and heat taxes both reduce the sales volumes of HTPs. So remember we mentioned that they are priced very similarly. So when there is an increase in the cigarette prices, it may lead to an increase in the HTP price as well. So that's potentially an explanation of why we see higher cigarette taxes also reduce the HTP volume. So here, because of this, we can interpret this as a sign of complementary products for the HTP and cigarette relationship. So in economics, we often consider two products relationship in terms of whether they are substitutes or whether they are complements. So here, although we find signs of complementary products for these two products, because of how they are priced and because they are mostly produced by the same company. So we can't tell for sure whether these are complements or substitutes from the regressions. But anyways, I just want to show you the other results, including the price elasticities. So here we find higher HTP taxes lead to higher HTP prices. A $1 increase in taxes leads to a 5% increase in HTP prices. And we also find higher tax burden on cigarettes than on heats, HTP heats. And then again, higher cigarette taxes also lead to higher heat prices, and there are different mechanisms to explain why. So whether they are complements or substitutes, so whether HTPs and cigarettes are complements or substitutes is still unclear. And when we look at the price elasticity of HTP demand, it appears to be considerably greater than that of cigarette demand. So a 10% increase in HTP heat price reduces HTP heat volume by 83 to 132%, and the device volume by 36%. Whereas a 10% increase in cigarette prices leads to a 2 to 6% decrease in the sales volumes of cigarettes. So there are some limitations of this study. I don't want to go into details, but again, we need more data. So there are no limitations of Euromonitored data that don't have all the HTP sales. And also some of the HTP tax information is missing. So we can't use all the countries where HTPs are sold in our analysis. And also we only have 3 waves of data so far. Although we're going to add another wave of data, we still are limited to the availability of data sets. And then we'll add other controls. So here is just a very simple regression approach. And in the future, we're going to control for the demographics of the countries. And also here, we only use the information of prices from that PMI. So all those other brands price, for example, Gilo, Leo, we don't have them. So when we look at PMI heat price, that's another limitation we hope we'll tackle in the future. that concludes my presentation today. Thank you.
Thank you very much, Dr. Shang. I find it actually a very unique study, and yeah, what I noticed, which goes along with the previous presentation from Silvano, is that the lower tax on heated tobacco compared to conventional cigarettes. And we're a bit late on the program, so I'm passing the word immediately to Alena Tigova, who is a researcher and scientific project manager at the Catalan Institute of Oncology at Tobacco Control Unit. So Alena was involved in coordination, management, and research in many European Union Horizon 2020 research projects, such as TAC that she's presenting today, but also ERAS Plus, and furthermore joint action on tobacco control. So Alena, please.
Good afternoon, everybody. Thank you very much for the presentation, Paulina. I will, since we are short on time, I will go directly to the presentation. So as Paulina mentioned, this session can be a good wrap up to the whole session. And I will present the results about prevalence of use and passive exposure to aerosols of novel tobacco products and electronic cigarettes that comes from TAC study that Silvano mentioned earlier. I'm glad that in panel today we have two people who were partners in this project, Professor Luc Lancy and Dr. Silvano Gallos, and I'm very thankful for their support. In this presentation, I will briefly introduce the project so we have a background from where the information comes. And then I will briefly highlight some prevalence per country and with some socio-demographic characteristics on use and passive exposure to these products. So just as a brief highlight, here you can see the overall aim of the project. It aimed to provide scientific evidence on exposure assessment, burden of disease, and development and evaluation of interventions that aim to tackle secondhand tobacco smoke exposure and exposure to electronic cigarettes and their impact on respiratory health. To briefly have a picture of the project, it lasted for 4 years, from 2015 to 2019. It was coordinated by the Catalan Institute of Oncology that I represent, and 11 institutions from 6 European countries participated. I will present the results of just one study of this project, the survey, but overall we had 9 comprehensive studies in the TAC project. I would like to acknowledge the input of all collaborators. As I mentioned, there were 11 institutions from 6 European countries: Ireland, UK, Belgium, Spain, Italy, and Greece. And here you can briefly see the scheme of the studies that comprise the project. I invite you, for the sake of time, to check our website that you will see at the last slide. And if you find interesting and have any questions, please don't hesitate to contact me. And today I will present a few results from the survey on secondhand smoke and electronic cigarettes exposure that was conducted and coordinated by the Mario Negri Institute based in Milan, Italy. And I'm very thankful for Silvano, Alessandra, and Giulia team who worked very hard on this survey. Briefly, the methodology, it was a face-to-face survey that was conducted mainly in 2018. Italian pilot was conducted in late 2017. It was conducted in 12 European countries at that moment, and they represent 80% of the EU population. And the sample of almost 12,000 participants is a representative for general population 15 years old and older. And it's also representative in terms of sex and other social demographic characteristics. A few scientific manuscripts, and I saw that in chat we had a question already about one of them. So we have 2 manuscripts that were already published, one about prevalence of smoking, another about secondhand exposure to aerosols from electronic cigarettes. Both are already published and available online. And one about use and awareness of heated tobacco products in Europe is already accepted for publication and will be shortly available for public consultation. So, as I mentioned, I will briefly give some highlights about e-cigarette use and exposure to electronic cigarette aerosol. first, and then I will briefly talk about heated tobacco products. So on this map, you can see overall prevalence per country. Among all 12 countries, the prevalence of use of e-cigarette was 2.4%. It was more or less similar among men and women if we look at all countries together. And it ranged from 0.6% in Spain to 7.2% in England. When we looked at the country difference by use of e-cigarettes by sex, we can see that there were different patterns among countries. We have some countries like UK, France, or Romania, where more women use electronic cigarette at the time of survey, and some countries where it was more prevalent among males, like Greece, Bulgaria, Germany, Latvia, Portugal, and some countries with more or less similar use, like we can see in Ireland, for example. When we look at the characteristics of current use separately, occasional users and regular users, we can see that 1.7% of respondents were regular users, meaning using e-cigarette more than once a week. It was more prevalent among men, in young people, particularly in group 25-44 years old, and among people with higher level of education. If we look at regular vs occasional or past use of electronic cigarettes, we can see that the patterns are quite different among countries. We have some countries with many people who have tried the cigarettes in the past and are not using them nowadays, like we can see, for example, case of Greece or Bulgaria or Latvia, and where the proportion of those who are occasional user are also significant, like for example, UK, Greece. When we switch to secondhand aerosol exposure, the aerosol that is produced by electronic cigarette, and we're talking here about non-users who are exposed to this aerosol, 6.5% of non-users among 12 European countries reported that they are daily exposed to secondhand aerosol. And it ranged from 4.6% in Spain to 31% and 0.5% in Bulgaria. When we looked at the exposure to aerosols by settings, on overall among all the countries, it was 16.3%, and as I just mentioned, it was often reported in other indoor places. Here, mainly we are talking about hospitality venues such as bars, restaurants. 8.3% of non-users reported being exposed there. Also 6.5% reported to be exposed in workplaces, 5.8% at home, 3.9% in public transport, and 3.2% in private transport. Interesting, what we would like to highlight is that when we compare how many smokers we have and how many people report being exposed to secondhand smoke, and then when we look the same pattern for e-cigarettes, we can see that in Europe, each electronic cigarette user exposed daily more than 6 non-users, which is a lot more than when we look at the conventional cigarettes. And here we can develop the discourse about why it comes from and whether e-cigarettes are used to circumvent existing smoke-free laws. Here you can see briefly a summary of what was just presented. The prevalence are an average 2.4%, ranging from 7% in England to 2% in other countries. It's mainly used by young people. And if we exclude UK from the analysis, the majority of e-cigarettes users are dual users, using also conventional cigarettes. When we look at the secondhand aerosol exposure, 16% of non-users reported being exposed to secondhand aerosol in various indoor settings. When we compare exposure to secondhand smoke and aerosols from electronic cigarettes, we can mention that each smoker daily exposes less than 1 non-smoker to secondhand tobacco smoke, while each e-cigarette user daily exposes more than 6 non-users. Here I would like to switch to some data about heated tobacco products. Some of it was mentioned by Silvana. Here is information about awareness of existence, since it's a new product. One of the first questions we wanted to ask the participants is if they are aware about this product. And we can see that it differs a lot by countries. For example, almost 50% in Greece of the respondents knew that what is heated tobacco products, while almost 85% in Spain never heard about heated tobacco products. When we looked among all countries together, 72.2% of the respondents said that they have never heard about heated tobacco products. 26% said that they have heard of it, but they don't know what it is. And 1.8% have tried or used it. And if we looked already into the subsample of those current heated tobacco users in the sample of respondents, almost 17% never smoked traditional cigarette. 65% were current smokers of conventional cigarettes, and 19% were ex-smokers of conventional cigarettes. When we looked at the use, overall among 12 countries, it was 1.8, almost 2%, and it ranged from 0.6% in Spain to 8.3% in Greece. Here we can see a trend that Greece was also one of the markets where some of heated tobacco products were lately produced a lot, marketed a lot, and we can see that in Greece it was higher than in other countries. When we looked at some social demographic characteristics of those respondents who reported ever use of heated tobacco products, it was more frequent among men, among younger participants, among participants with higher education level, and those who were current smokers of conventional cigarettes. To wrap up, I'd just like to mention that in 2018, 72% of the population in the country studied never heard about heated tobacco products. 26% have heard about the product but didn't know what it was. Among 12 countries studied, almost 2% were current users of heated tobacco products, and it ranged from 0.6% in Spain to 8% in Greece. More frequently, ever use of heated tobacco products was reported by younger male respondents with high level of education, and among current users of heated tobacco products, 64% were current cigarette smokers. Thank you very much for your attention. I would like to thank all partners of the Touch project. Without their support, it wouldn't be possible to conduct the study. And I invite you to consult the website of the project that you can see here if you have any further questions. Thank you very much.
Thank you very much, Elena. I think it was a great finishing presentation, like this overview, the takeaway for all of us on the situation in Europe. We unfortunately exceeded the time with so many great presentations today, and I see that most of the questions has been replied online, but I saved all the questions and will try to reply via email to the ones that are still pending. The recording of this webinar will be available on ECTC on the conference website, as well as the presentations, so you can share with your colleagues who couldn't be present today online. I would like to thank again all our panelists for taking their time so close to holidays, such a busy month for everybody. Thank you so much for sharing this novel results with us. And I take this opportunity to invite everybody to join the last webinar of our ENSP ECTC series tomorrow, which will be in more interactive format. And it is dedicated to the road to smoke-free generation. So thank you so much, everybody, and I wish you a pleasant evening.